Hi, my name is Kathy Nudzinski, and I'm a licensed practical nurse, and I'm here today to talk about implementing electronic health records into the facility I work at. Within this presentation, I will discuss the ramifications of paper medical records, which include illegible documents which allow margin for error, issues with storage and accessibility, and the risk of breach of confidentiality. I will also discuss how electronic health records will be the solution to this problem and how we will go about implementing this change. Included in this outline will be the involved personnel, a detailed budget, the conclusion, and an opportunity for the audience to ask questions. The first ramification with paper medical records is problems with illegible documents. Everyone has different handwriting, which sometimes make physicians' orders and notes hard to read, which could be possible to make a medication error. It has been estimated that greater than 44,000 errors occur annually in a 735-bed hospital due to difficulty reading orders, according to the American Nurses Association Journal of Ethics. There is not always enough room on the paper to complete the order that you need to write. These documents are not able to be saved or shared electronically, causing us to make photocopies. Paper is expensive, making it not cost-effective for the facility, as well as time-consuming. There are almost 200,000 deaths a year from preventable medical errors, according to an article from Buckley in 2010. The second ramification with paper medical records is problems with storage and accessibility. How many times does a physician lose labs because they were loose in a chart, or have to reorder tests because the paper results have been lost? According to one study, paper charts are always missing 25% of the data, whether it be lost or in another department. This statistic proves great financial burdens. Paper records require additional personnel to handle and organize these countless documents. Also, it limits the doctor to access these files only during office hours. The third ramification I'm going to talk about with paper medical records is confidentiality. Since this data is not computable or able to share via the internet, we need to make copies for patients, whether they leave the facility for a doctor's appointment or for the doctor's review. Therefore, we need to copy, transport, and store this information. This makes it easy to lose these papers and makes it accessible for many to find this confidential information. There is no way to determine who has actually seen these documents. Security breach threatens patients' privacy when confidential health information is made available to others without the individual's consent. Keeping records secure is challenging to both doctors and the federal regulators. So what is the solution for all these problems created by paper medical records? Electronic health records. This method provides accurate and quick documentation, it's cost-effective for the facility, and it will reduce medical errors. In our facility, we currently have 3 desktop computers that will gain access to the electronic medical records software. However, we will need to purchase 4 tablets, 1 for each floor, and also we'll need to purchase the electronic health record software. So this project from start to finish will take less than 2 months, and with the final evaluation phase finishing in roughly 6 months. The personnel will include a project manager, the director of nursing, the doctor or nurse practitioner, and the charge of floor nurses. So, the budget breakdown for this project. The vendor cost, which is the software and the interface, will be $50,000. The hardware cost, which includes the Dell database and the 4 tablets, is $30,000. The cost for the surge protectors and wiring will be $5,000. The project team to do the chart scanning will be $2,000. The project manager, who will hire for 6 months to see us throughout the whole process, will be $25,000. And the training time for the staff will be $5,000, making our grand budget to switch to electronic medical records $117,000. In conclusion, implementing electronic health records is affordable, effective, fast and will increase patient safety and outcomes and protects our facility from lawsuits. And now we'll open it up for questions. First question, does the software get backed up in case of a power outage or shortage? Which is a great question. This software does get backed up in case of an emergency. However, if the power is out and you are in the middle of a medication pass, you will need to print paper MARs, which should be ready at your station on hand to complete your medication pass until the software is back up and running when the power is back on. Second question, how many facilities have seen a reduction in medical errors since they have implemented the electronic health system? Also a good question. The survey says that 63% of facilities have reported fewer medical errors, while 75% of providers say that electronic health records allow them to provide better quality patient care. So that's it. Thank you so much for taking the time to listen to my presentation. I hope it educated you on the importance of implementing the change from paper medical records to electronic health records, not only for the physicians and nurses, but more importantly for our patients and residents.